I'm Dr. Ghias. I am an HS specialist and dermatologist by training. And I've been involved in HS for about 8 years now. It's actually funny, we were just talking about how, I presented at the first ever HS conference about 8 years ago now, and just how far we've really come and how much the community has grown and the research has grown, and that it's really incredible to be here with you all. And I'm also the co-founder and chief medical officer of Tono Health, which is the first ever HS specialty clinic that's virtual to really increase access to HS specialists across the country.
You guys have a QR code that'll take you directly to Tono Health's destination URL at the end of the packet too. Come on in.
Hello, welcome. How are you?
Ooh.
Oh no.
Can you help me out?
We have handouts.
We have handouts.
Thank you.
All right. Does anybody have any questions for Dr. Ghias about her background?
We'll have plenty of time
We have plenty
to
of time.
discuss more.
Cool. So that brings us to me. My name is Yasmeen Yount. I have a master's in behavioral sciences as well as a master's in business administration. I'm the founder and managing partner of Curated and Collected, which is my own personal health and wellness lifestyle blog. So while I am a HS patient going on 22 years and Hurley stage 3 at various times in my life, I don't present as such, or it doesn't also bleed into my personal life or into my professional life in the way that it does for some of y'all. And we're hoping in our partnership and our conversation today, we can talk about how the curation of a very specific type of care team has led me to have that autonomy in my life. If you were here yesterday and you listened to Dr. Kristen Oha, who is a functional medicine provider, she's a part of my care team, will help put those pieces together on the selection of certain physicians and how that works. I do not do this full time. I am an automotive enthusiast professionally, so I manage automotive data and manufacturing strategy, trying to make it to a boardroom one day. So that is the goal for all of us, is that you can say, oh, she's an AHS patient, she's also a CEO. So that is my hope and our goal. You guys are welcome to follow me on Instagram or Curated and Collected. I have a pit bull and a Cocker Spaniel poodle and a husband who will inevitably show up at some point. All right.
Amazing. So the goal for today is to have some fun, to talk about HS, to learn from each other, to share some stories, and really we want to create, a safe environment to have real conversations about things that are top of mind.
That being said, you can interrupt us at any time. This is
Yes,
very
absolutely.
conversational, so don't treat it like a lecture.
Oh, yes, that's
Oh,
perfect.
yeah. Sorry, I was like, microphone?
Yeah.
I had a squirrel moment. I was like, huh?
Yes, and by the end of the workshop, we want you to have the tools to be able to find and select an awesome team of doctors to get better outcomes by being an active participant in your care. And finally, enjoying the tools that make this a sustainable journey that is long-lasting, because HS is a long process, and it's going to be a journey.
And we all hope we grow out of it one day. Would be so nice. Cool. So we will start with key takeaway number 1, which is on our first page, and that is creating a multi-specialty care team led by an HS specialist. So I will let Dr. Ghias talk about why it's important that that team should be headed up by somebody who is as native to the disease, short of being a patient.
Yes, absolutely. So going to the next slide.
Gotcha.
So first I want you to think about your current care team. And who are the providers that you are currently interacting with? What are some of the challenges you've encountered? And what is top of mind to you? What do you hope to gain from your care team? So if anyone wants to share their existing experiences or current care team, or just wants to kind of think about it, I think it'll help to set the stage for how best to guide the discussion and on specific areas to focus on.
It's also okay if your care team is non-existent or is a team
Yes.
of one and a mom and a best friend that's also, those are all really good starting places too.
Absolutely.
Go. Yeah.
So I just found an HS specialist this past December 2020. Let me start again. Yeah.
This is going to the stream.
Oh, okay.
Oh,
Yeah.
awesome.
So I just recently found an HS specialist in 2023. That's when I was diagnosed. But I've had it for 13 years. So it's been a tough journey trying to find somebody who specializes in HS. And so just my dermatologist, my gynecologist is actually the one that pointed out that I had HS
Yeah.
for me to see the specialist. I don't know, this might be a differential diagnosis, but soon to be rheumatoid arthritis as well.
Comorbidities are a real thing for us.
Yeah.
It's okay to talk about them.
Yeah, and my mom
Absolutely.
here, she's been quite supportive on the journey too.
That's incredible.
So how old are you?
I'm 26.
So you would have had an adolescent.
Yes, so when
Okay.
I was 13, that's when I started developing symptoms.
If it makes you feel any better, I am 33, so I was diagnosed when I am 11. So my mom, we understand. Yeah, we get that. All right, we got a few more.
Yes.
So currently I'm with a great care team that is absolutely a game changer for me. Challenges that I have faced, even still to this day, if I have like cellulitis and it's on the weekend, I can't get a hold of my doctor, I have to go not urgent care, either urgent care or the hospital, one of the two, whatever is open and closed. And I hate going because so many medical doctors do not even know what HS is. And I have to sit there and school them, and they're trying to like lance it. I'm like, you're not touching me. I just came for
Right.
antibiotics. Thank you.
I mean, cellulitis
Yeah.
is very uncomfortable.
Yes, and it's like something that I faced a lot last year, and it was to the point where I just started asking my doctors, like, can I just have a bunch of refills, please?
Yeah, absolutely.
Because the medical providers out here are clueless, and it's a struggle, and they're like, yeah, it's not a problem. Here you go. So
Yeah.
it's been good, but I wish more medical professionals knew about it. Even, nurses. The nurse stood there and just looked at me like I was crazy. I
Yeah.
was just like, thanks for making me feel uncomfortable, but it's okay. I got this.
Yes.
So pro tip, if you know that you were prone to a secondary infection as part of your flares, maybe ask your derm if it's okay to have
Yeah,
autonomy for
especially
refills.
if that is something that has traditionally worked well for you, and you know that, and they know that. Again, this is where that really patient-physician partnership aspect plays such a huge role in empowering you, because maybe you don't feel like educating every urgent care professional, and that shouldn't be your job. And there's so many efforts going on to continue to improve that. But in the meantime, it definitely helps to just have other options.
Definitely.
I think it's fair to call out that a level of care for HS can almost feel like it has to be a concierge level because we require so much intensity of care so frequently, especially while we're getting started. So it's okay to call that out wherever we're struggling with that.
Yeah.
You had something you wanted to say?
Hi, my name is Rachel.
Hi, Rachel.
Hi, Rachel.
I was diagnosed in 2018, or no, in 2020. In 2018 is when the symptoms showed up. My regular derm is awesome. She's fabulous. And she was like, yeah, I'm going to refer you to the HS clinic downtown. I'm local. So I have great dermatologists. Like, I've never had a problem with any of them. They've been very, very supportive. I actually see the big three down here. But what I am having issues with is my primary care physician doesn't understand the inflammatory nature of this disease, so she keeps trying to push other meds on me that I don't think are actually what's going on. They're not going to really help long term.
Yes.
And she's really supportive and really trying, but I just don't. There's something's missing. So my
Yeah.
goal is to really find a good PCP that can
Yeah.
help, because there's a lot of other things that happen when you have HS.
Yes,
and so I need somebody
absolutely.
that understands that. I also work with a naturopathic doctor as well. So somebody from the eastern side of things. She's been great. Spoke with the naturopath that was here yesterday. She's great, so I might start working with her. Again, same thing. They don't know enough about the disease to really
Right.
pinpoint down.
Yeah, but they're willing to work with you
Yeah.
and learn.
Yes.
Yeah.
Yeah. And then same thing with like even a therapist. My therapist isn't really. I'm learning, like, I think I need to move into like the chronic pain type of
Yeah.
therapist person versus just like a general one. So like there's some things where like now I feel like we need to get a little bit more specific. So
Yeah.
just like finding those people is like what I need help with. Like, how do you find them?
Absolutely.
We
No.
will talk about that and take
Yeah.
away this one in number 2, and we will also talk about how it's okay to leave a physician.
Yes.
Yeah, and then if there's, I don't know if there's anybody else in the care team, like, do I need to see a rheumatologist? I don't know.
Yeah.
Like, what other
100%.
specialties, if there was a specialty,
Yeah.
would it be good to have a consult with? So.
Yeah. And then
Yeah.
back row. Oh,
So, Erin again.
Hello.
I'm very bad with time, so I don't know when it started. I just know I was a child, and it would come up occasionally. I'd get it. I go to the emergency room with my mom, and they just cut it open. So, and then it just got progressively worse. I'm 33, and so it just went all downhill in 2022. I kept getting hospitalized. I had
Right.
been septic 3 times, including this year. I had 2 surgeries. Dr. Siddiqui is my surgeon, plastic surgery. I occasionally go to the New Center one for dermatology. I don't know if they're really doing anything because I just feel like I
Yeah.
go in, they look at it, they say, okay, and then I leave.
Yeah.
So I'm really not sure who I should talk to.
we got some resources for you.
Yes.
But I feel like a change should happen. Like, I've been on
Absolutely.
a lot of medicine. I was doing infusions with infliximab. That stopped working. I was on ertapenem, I want to say. They put like a PICC line in my arm. They took that out earlier in January. And then that's when it just went all downhill and I got septic
Right.
again. And
Yeah.
So now I'm on Cosentyx.
Right.
So hopefully that works.
Hey, we're Cosentyx friends then. Also, do you all mind? So that's my lovely husband, and he has coffee for us. Do you mind if he walks in and brings us?
Right. And who is next?
Okay, cool.
Oh, yes.
Glow in her yellow so she can glow.
Yes.
Yay! All right, so I feel like I've been working really hard
Thank
on
you so much.
creating
Thank
that
you.
medical dream team for me. I have just the most amazing HS specialist, Dr. Ghias, who
you.
has been helping me with my care tremendously. But something that is still a challenge for me is getting everybody else on board with the HS. So now you have a great HS specialist and you're getting conflicting information because of their lack of knowledge and them telling you, oh, well, based on the specialty that I have with you, like, oh, you shouldn't be on this or this, that, and the other. And just being able to say, hey, can you guys just talk?
Yeah.
Well-
Can you talk to each other and get
Yeah.
this together? Yeah.
We will talk about the yielding. So yielding to whomever is at the top of your hierarchy or whoever, and that comes down to the prioritization of like where you are today in your symptomology or your pain or what your goals are. We'll talk about is Dr. Ghias the top of your pyramid? And then everybody else sort of needs to fall. I don't want to say fall in line because it sounds very harsh, but
I say wrangle the troops. So
Yeah.
I think we're the
Yeah.
same.
they're either falling
Kind
in
of like
line or you're
leading the charge, being the quarterback. You know,
Yes.
there's a million different analogies.
There's no I in
but
team.
someone who
Yeah.
is leading that initiative and able to, communicate with these different doctors to get everyone on the same page so that everyone is just, aligned. And it's really about creating a care team that is surrounding you and supporting you.
Yep.
And collaborating with you and also with each other.
So I think we've highlighted this, but just to ground us in the statistic, 54% of HS patients reported that their providers lacked knowledge about HS or treatment options.
Yes.
I think
so
we've-
I know that many of you shared experiences with that, and sometimes it's just good to know that you are not alone. A lot of people are experiencing this, and I think that together we can figure out a way to find different solutions or strategies for when one of your doctors doesn't know what to do. So what is the HS Dream Team? Well, a few of the key roles, again, this is going to really vary depending on the person because everyone is different and everyone is going to have different needs and different subspecialists that are going to be a part of their care team. But overall, you want to think about a team that involves a dermatologist, ideally someone with expertise in HS, and for some people, it may also include a surgeon, and then these various subspecialists are really going to depend on other symptoms or other conditions that you may have, whether these are just some of the common ones, endocrinology. I do think it's really important to have a primary care doctor that understands your condition. And going back to what you were mentioning earlier with therapists, you know, there's different types of therapists. And so there was a therapist or a psychologist that we were working with before that specializes in medical therapy or like medical conditions. So she had done her PsyD specifically on pain associated with HS and on living with chronic conditions. And so, you know, even within the realm of some of these subspecialists, you know, within psychology or psychiatry, there's a lot of variability and being able to find the person that's the right fit for you.
I will say I can go ahead and I will tell you what, if you would like an example, the care team that I have today is a dermatologist. She is at the top of the pyramid. Everybody else yields to her. It is an obstetrician gynecologist who is not super familiar with HS, but she is familiar with my dermatologist line of research. So there is a level of respect and rapport there. I have a functional medicine doctor who functions as my PCP. She has a working rapport also with my dermatologist. A lot of times that working rapport is through me, making sure emails are responded to or text messages are responded to in a timely fashion. I am working on physical therapy because apparently after 40, women start to lose muscle mass. I don't think that's fair, so I'm lifting heavy things to combat that preemptively. And then I have a psychiatrist who specializes in somatic traumatic response. Our bodies store trauma, muscles store trauma. I'd like to not carry that trauma, you know, into my late 30s, into my late 40s. And then through my functional medicine provider, I have access to a dietitian and I have access to a lifestyle coach or somebody that I can go to and say, hey, I want to be better about flossing regularly in addition to everything else that I have to deal with. And she'll say, okay, floss in the shower while you're waiting on your conditioner to set. So little things like that. So just to put it out there, it can be this you have an endo, a urologist, an OBGYN, and an HS specialist, or it can be a naturopathy and an HS specialist and a psychiatrist. It looks different for everybody.
Yeah, and sometimes it requires a little bit of trial and error to figure out what that right balance is for you.
Yes.
So once you've built out a team or are reassessing your team, what are you looking for? How do you know, okay, like this team is meeting the criteria that I want and need? Basically making sure that your various doctors or providers have expertise in the area that they're responsible for. And then do they communicate and collaborate with me? And are they able to communicate and collaborate with each other? Because that also plays an integral role. Do I trust them? Do I feel supported? Are they working with me to find the right treatment based on various stages of life or that's compatible with my lifestyle? Because these things all change. At different points in your life, you might need different things. And is it accessible? Is it convenient? Again, is it conducive to me living my best life and, having HS be an aspect, but not something that's just, controlling my entire life. So those are some of the things to think about. And so this whole, pyramid structure, or basically just how do you go about building this medical dream team? So one of the ways is to start with an HS specialist. Why? Because they understand HS and they're going to understand, what resources they can recommend and work with you and really collaborate on adding in and layering in these other elements. So, talking to them about, hey, I've been experiencing some joint pains, et cetera. Is there someone that you would recommend I see or speak with?
I also think it's okay to call out your first HS specialist may not be your best fit. You are all unique people.
Yeah.
You gotta vibe with your doctor. You don't vibe with your doctor, it ain't gonna work. So while we absolutely 100% recommend HS specialist, if you don't vibe with the first one, don't let it deter you from going to the next one. That is gonna be a mantra for looking for doctors in general, and I know it is exhausting, and I know it is emotionally taxing to have somebody speak down to you, to have somebody tell you that the pain you're feeling or anything that you're feeling is not valid. But at the end of the day, like, steel your spine, scream when you get in the car, get what you need, get a referral if you don't need it, and you got to keep going. So just want to call that out. You may not vibe with the first doctor that you see.
100%. And it's constantly reassessing these, and feeling empowered to find the person that is the best fit for you. So then, getting referrals to build out the medical dream team. So one of the options is, asking this HS specialist, hey, do you have recommendations or like other resources that I can use to add an endocrinologist or a PCP that meets these needs? This person and I are not really collaborating with, and I want it to be someone that works well with you.
I would also be prepared to understand if you are covered under insurance or if you are not and you're on Medicaid or any Medicare, you understand what the referral process is. Mm-hmm. If you have to get a referral from a PCP to go see any type of specialty, you understand what documentation that you need. And let's say, for example, you don't vibe with this PCP, but you really need this referral, you can still get that PCP to fill out that documentation to give you that referral in that appointment. So it's also, and again, when we are in pain, I know we are tired. I know we have very little capacity to want to deal with stuff. But if you prepare for those things in advance, stick them in a draft email, stick them in a Google Drive, have them pulled up and readily accessible, you can still walk away with that paperwork that you need to move forward. But it also means, and we'll talk a little bit about this, you got to understand what the referrals, your prior authorizations, we'll talk about this later, is necessary to get there. So there is a little heavy lifting that we have to do, which is unfortunate because, again, I know how debilitating the pain can be. But I believe that if you work your plan and plan your work, it tends to work out.
And again, it's a journey. It's not something that happens overnight. Again, part of it is almost like trial and error, or kind of like dating. You may not be compatible with every single person, but over time you find the right balance of what works for you, and also you start to get more in tune with what characteristics of doctors you may want to prioritize that fulfill these needs. So where do you find an HS specialist? Many of you may already have an HS specialist. One great resource that I'm sure you've all heard about from this weekend and maybe before is the HS Foundation. So definitely a great place to reference.
QR code in the back for HS Foundation. So I will say all these QR codes expire in 10 days because I didn't buy them in perpetuity. So scan them, save them, but all the online material that we're referencing, we will give you access to.
Yes, absolutely.
Sorry.
And so where to find these great doctors, to build out the rest of your care team. So we talked about, where to find HS specialists. If you don't have an HS specialist, the HS Foundation could be a reference. You can ask your existing doctors if there are people that you do work well with. You can go online, read reviews, etc. And I do think that another really great point of reference is HS-specific resources, coming to awesome events like this, and speaking with people in the community or groups and sharing these experiences and kind of gauging, what various options could be.
To give a very tactile example, my obstetrician gynecologist was referred by my dermatologist. So I just asked her and I said, hey, I don't like who I'm seeing. I don't like that I put my feet up in stirrups and scoot down, and there was an audible at all of the scarring. Didn't work for me.
Yeah.
I laughed it off, but it didn't work for me. So I went to the derm, and she's like, actually, I really like this one.
Yeah.
Love her. She's great. She's awesome. She knows what she's got to do in that annual. She knows what she needs from my doctor to be best prepared for that conversation. I found my psychiatrist through my functional medicine specialist. I had to change. I had a psychologist who was treating patients with HS, and it was not working for me. If y'all can't tell, I'm a get up and get shit done kind of person. And she was too much in the let's stay seated. I was like, it's not gonna work for me. It doesn't work for what I want with my life. I went up and I got a referral. That's how we are. So this is how it works. I'm not saying this I'm not trying to sound like I have a lack of empathy. I have a tremendous amount of empathy for everybody in this room, but we are also our own best advocates in these things. So.
Yeah.
I will pep talk you all day long, and I will give you 72 hours to wallow, but then you got to get up and do something.
Yeah, so as you are imagining your medical dream team, what do you see? What are some of the key characteristics that you would find most important to having that effective patient-provider relationship? And what are some of the challenges in finding that? So if anyone wants to, share any of their experiences, yes?
Hold on, microphone coming in.
Oh, sorry.
Thank you.
I had quite a bit of challenge in receiving my medication. I was recently given a biologic, Humira, and my HS specialist wanted me to start using it in January, but I didn't receive it until March. So constantly I had to go on the phone, talk to insurance, talk to the pharmacy, going back and forth.
Yeah.
They were both pointing fingers at each other, saying they didn't bring the right information. So I was just like, whoa, where do I go? So it was really tough, and I had to explain the process to my HS specialist and said, this is what I had to do. It was a lot for me, and I'm also in the healthcare field myself. And so if I didn't know the ins and outs and nooks and crannies, how can somebody else who's not in the healthcare field figure this out?
Absolutely. That is something we hear and probably experience, all too common is just the nonstop hurdles to getting to where you want to go.
The red tape.
Yeah.
We will talk about this towards the end, but we have some pro tips on, I'm sure we've all heard you catch more flies with honey than with vinegar. We will talk about how back office specialists, the medical assistants, the nurses, the people at the front desk, they are your biggest resources when you are in a doctor's office to get documentation and what you need to move forward. And we will talk a little bit about that a little bit later.
Yeah, absolutely.
Anybody?
Anyone else with key things? Okay.
When you were talking about how hard it was to get your medication, it was very similar for me with Cosentyx, because it was, I think, approved this year.
Yeah.
And then after I had my surgery in February, my dermatologist was like, oh, yeah, you can get this now. And I was like, okay, great. So where is it? And it took so long. They was like, oh, just call this number. And they was like, okay. Oh, wait, there's something wrong. Something about authorization. I had no idea what that meant, but
Prior authorization, the PA word?
yeah. And so I'm just waiting after surgery in February, and I'm like, I need to be on something.
Right.
And I literally got it 3 weeks ago, and then hospitalized the next day because of the infection that's been building up, because I was literally on nothing since early January till about 3 weeks ago. And so it's like that surgery was nothing because everything is just kind of back.
Yeah.
And so
Do you feel like your dermatologist has the office staff structure to support you guiding through what, not necessarily filling out forms for you, but what forms may be holding up your access to medication?
maybe, because again, I was like, are you sure I'm supposed to be calling them to get this done, or is it supposed to be
Yeah.
you?
Yeah.
Because I was
Or
like,
someone on your team.
yeah,
You know?
he was like, just call the number, and I called
Right.
the number, and it was like, no, this isn't the right one. You need to go here, and I was transferred a bunch of times, and after a while, I just gave up.
Yeah,
Right.
it's
And
exhausting.
then, and it's very infrequent that I go to the dermatologist in the new Center One building. So by the time I went back, they were like, "You're not on it." I'm like, "No, I never got it."
Yeah.
And so, like, this was like May 9th that I saw them, and I got a call right after I left, and I was like, "Okay, we'll send you the medicine." Oh, wait, authorization. I'll
Psych.
call you back, and then they never did.
Yeah.
But eventually I got it.
Well,
Yeah. And that lack of communication, sometimes is very frustrating. And the lack of control or just even awareness about where in the process are we. Sometimes even sharing an update with people like, hey, we reached out to them on this date, still waiting to hear back. We're going to follow up on this date. Just helps to have that partnership dynamic that is both empowering for you and empowering for the doctor. But
Yeah.
it's hard. Anyone else?
oh, sorry.
Thank you. I didn't get a chance to comment on the initial one about the dream team, but I think this question kind of ties into it. So I don't tend to compartmentalize a whole lot in my life. So my dream team is kind of like life dream team, but I've got the medical component, if that makes sense. So I do have dermatologist, PCP, gynecologist, and I wrote them down so I wouldn't forget everybody. Support groups, so HS specific support groups, and specific doctors that I'm able to talk to about that. Family and friends, I've got an uncle who's an oncologist and an aunt who's a nurse and several doctors, and the children I'm raising are in Wayne State Future Doctors Medical School, and they're interested in dermatology.
Congratulations.
So
Like,
sometimes
that's
I'll run things
amazing.
through them, their kids, literally, but
Yeah.
they'll
Yeah,
give me a
yeah.
different
My
perspective
cousin went to Wayne
sometimes.
State for med school.
Yeah.
Yeah.
So it's
That's so
kind of
special.
fascinating just to see the advances, but also the future generation and their
Yeah,
interest
absolutely.
in HS specifically,
I
which
have
I'm like, I didn't even know what it was
I have
before.
so much hope for the 11-year-old me that shows up in the next 10, 15 years.
Yes.
Yeah.
So,
Yes, it's powerful. So I also have a team of pharmacists, team of dietitians, mentors, personal trainer, lifestyle coach, and I'm probably missing several people. But for me, one of the challenges is I'm an executive studying in law. I've got a lot going on. I travel a lot, and I
Yeah.
just got my diagnosis just about 2 years ago, but I had symptoms for about 20 years.
Yeah.
So I was
Right.
misdiagnosed. So that's probably the biggest challenge for me, is just kind of learning more about HS, the comorbidities and things of that sort. So it kind of ties into the next step for
Yeah.
me of what I want to see in my dream team is just more collaboration, if that makes sense. Thankfully, a lot of them I kind of work with on a professional level in
Yeah.
some
Right.
ways too, so we communicate probably in a different way, but encouraging that collaboration. So some of the work that I do is for continuum of care within the homeless community, and seeing how agencies can be separated with their care for the homeless. Like, okay, we'll feed you over here, but over here we'll give you clothes, and over here mental health.
100%.
But building that together to say everybody is working together to make sure this person is cared for. I want to see that happen in my medical life for me
Yeah.
personally. So that's kind of one of my
Absolutely.
big goals.
We'll talk
And
about.
I think that's so common, right?
Yes.
This disjointed aspect of the care, and almost like having everyone kind of pointing fingers at each other, being like, oh, this is with this person, I'm not responsible for this anymore. But some of these are unfortunate realities, but I think there are ways to, mitigate and kind of work through those challenges. So, the first step is, proactively acknowledging and kind of figuring out, okay, what are the key steps to navigating this system?
Is anybody in this room struggling with finding an HS specialist at the moment? Yes. Okay.
Yeah, so, a lot of people have incredible HS specialists, and that's amazing. And another option, if there isn't an HS specialist that is very close by to you or convenient with your lifestyle, et cetera, is that there has been a really big increase in virtual care for HS in partnership with your local providers, right? Because we all know HS has many different factors, and in a hybrid model, you can get, that a world-class HS specialist, and through virtual care, because derm is a very virtual,
Virtual
area.
friendly.
Yes, exactly, virtual friendly. And they can partner with your local providers who may not be as knowledgeable about HS and help guide them and help guide your care, and give you some of the tools that will help to augment that local care.
So the QR code for Tono Health is probably a really good place for you.
Yeah, and a lot of different hospital systems even have virtual care or virtual visits available. I think it's been really interesting to just see, the various outcomes and kind of this evolution from 2020 with COVID, when a lot of us were forced into a virtual framework.
Yeah.
And seeing how, afterwards, how we've built the infrastructure to really be able to deliver that same level of care effectively in a virtual setting.
So I'm being cognizant of time. We're
Yeah,
going to pick
yeah.
up the pace just a
Yes.
smidge. I'm not deterring you from asking questions.
Yes, yes.
We're just going to move a little bit faster. Okay?
Yes. All right. And so, this one, again, similar idea of just some of the outcomes that we've seen from the past year in this hybrid model of having the virtual HS specialist augmenting your local providers. For your reference, we can move on to the next slide with just information to have,
we
and
will
we'll
share the
this
deck with you guys.
Absolutely.
We're not going to
Yeah.
gatekeep anything. All right, so key takeaway number 2, engage as an active participant in your care. I know this is really hard as a patient. The number of times I literally asked my husband, can you drive me to the doctor, because I just do not have it in me today. I get it. A pain, trying to figure out how do I work it in my schedule, what am I going to do? Can I make it to Wednesday? Can I make it to next Monday? I get it. Unfortunately and fortunately, we have to figure out how to mitigate ourselves in this process, because we have to engage in a way that gets other people to work with us. At the end of the day, we are all human beings. And as wonderful as I would like to say as I am at controlling my EQ, when I'm pissed off, I'm pissed off. And when I'm in pain, I'm pissed off, right? And I'm not nice when that happens. But it's not fair to my employees or anybody on my team for me to take it out on them. It's also not fair on my doctor for me to take it out on them either. So that's just to say, we're going to talk a lot about communication, but I want to affirm I understand. It is uncomfortable and it is exhausting. And the last thing you want to do is have to smile when, it hurts to move. It hurts. I don't know what I'm going to wear today. I get it. So we're just going to put that out there, because we're about to talk a lot about communication, but I understand it's real loaded for us sometimes.
Absolutely. And so how do you become an active participant in your care? Well, congratulations.
You're here.
Exactly. You are already taking the steps to learn about HS, to learn about yourself, and to learn from others, from their experiences. And so, I think that is the biggest and most important step in the process. One of the challenging aspects that we learn, and that we've already heard today, is that even as an active participant, it's really, really hard to get the system to work with you, and that there's a lot of challenges, along the way. So on the next slide, so in this survey, 56% of patients said that their doctor lacked understanding of their condition. So again, you're not alone. A lot of people express these exact same frustrations. And other common, challenges were lack of empathy, not feeling heard, feeling rushed, etc., lack of personalization. HS is a very, multifactorial condition, and no two people are the same. So you can't really have this one and done approach of being like, oh, for every HS patient, I am going to do X, Y, and Z, because it does need to be an ongoing process and a partnership with the patient, asking them, hey, how did this work for you? How is this working for you? Is it working well? What are the side effects that you've experienced, et cetera, and how do we adjust and go from there?
I also want to call out at this point, if you're not having these productive conversations or you feel like there is a block to those productive conversations with the person that you are receiving your primary HS care from, it might be time to think about, maybe I need to interview and start asking for referrals. At any point, you are empowered to step away from your physician and to ask for referrals, and they should, in good business context, give you a referral if you ask for one. But again, if you are not able to have those productive conversations about like what day 0 looks like versus day 100, and your current derm is not helping you, or they lack the foundational knowledge for the disease, which is okay. We're all human, we all are here to learn. It is, again, more than fair to say, all right, maybe I've outgrown this. Thank you so much for the care that you've given me. Can you help me find somebody who can take it one step further?
Or you can also just get a second opinion, you are empowered to do that.
Yes.
You don't even need to tell them.
You don't have to. You can ghost
free,
them
you can
if
do
you
whatever
want
you
to.
want. Yeah.
You can ghost them.
Yeah,
But if,
you can talk to, sometimes I think a second opinion can be a good approach, again, and just learning more about different doctor strategies and styles and seeing what works best for you.
so this next one, I'm going to take a little bit of a lead on because Dr. Ghias respects everybody in her industry and her field. I can have a different...
But it's a real challenge.
But it is a real challenge. So why do patients stop partnering with their providers? Full stop. I gave you an example earlier. My feet are up in stirrups and we're in there for my annual pap smear. And she's like, oh, you're scarring, sweetheart. I'm so sorry. No, we're not going to have that conversation. I don't need you to call out something that I already know is there. I'm going to go find another doctor. I actually gave them no feedback on why I left. I just ghosted.
Yeah, it's not your job,
Yeah. So we find the possible reasons are lack of communication and accessibility, ineffective treatments, loss of relationship and trust. So I just talked about the loss of a relationship and trust. Ineffective treatments. I have seen another dermatologist. I have seen 4. None of them meet the standard of care that my current derm has given me within a mile. And so I'm very fortunate that she set that bar really high when I was diagnosed and has maintained that care for me. I did not go to school. I did not go to undergrad or grad school in the same state that I live in now, which is the state where my derm is. So we had to find other care for me in a different state. And that was a struggle. And ultimately, I ended up just driving home on weekends to receive care and then going back to school the next day, which we all know is also very stressful. So we can talk about some derms, just the ineffective treatment is just not there. And that's okay. We can move on from that. And lack of communication and accessibility, we've talked a lot about what is accessible to you. Are you vibing with the communication style? And they sound like really simple questions, but they're also loaded questions, right? A lot of times when we're talking about our pain or we're talking about our treatment, there are tears behind us and we're trying to hold it together, right? And you need somebody who understands that EQ there. And you need somebody who will give you the space if you need it. If you don't, that's okay too. Pro tip for any caregivers, if you guys want to share this, my husband reads dad jokes when I'm getting injections or things like that that are really painful. He will just pull up dad jokes and just start reading them as a way to distract us in our appointments. So there's some pro tips there that you can also lean on your caregivers if you're taking them to appointments with you. And at the end of the day, you have to communicate. We can't read minds. We can maybe read a little bit of body language, but we can't. I can tell if you got pain behind your eyes, but I don't know how deep that pain is unless you tell me. She doesn't know how deep the patient's pain is unless you actually tell her. So that's there too. It's a weird tightrope because you don't want to let the tears start flowing because it's real hard to stop them, but You got to figure out how to communicate how you're feeling in a way that is actionable and effective.
So, after asking 2,000 patients,
Which is a statistically significant sample size.
yes, what are your physician preferences? What we found was the number one thing was someone that specializes in my condition. Shocking, I know. Number two was a doctor that's the same gender as me. Again, I think that this varies for everyone, and sometimes it doesn't need to be all or nothing, but just some of the various things that we heard, and someone that speaks my language, probably because it is challenging to have that open communication and dialogue, if that isn't the case. Some of the other aspects that came up were convenience, after-hour appointments, someone that shares your same treatment philosophy, and communication style.
So I will say, and I'll put myself out there as an example, the only male on my team is my dentist, and it is because he is a part of the tribe, meaning I am related to him in some way, shape, or form. But everybody else who manages and works on HS treatment in my care team, they are all females. That is my preference. Full stop. That's okay to have that preference. It's also okay to say, you know what, my psychiatrist is a dude and he's great.
Yeah.
My nutritionist is a dude and he's great. It's good to say that too. Convenience, after-hour appointments, treatment philosophy, communication style. This is going to get a little bit into the history that I have with my physician. I have her personal number. I can text her on a Sunday at 5 p.m. She doesn't work on Mondays, but if I tell her that my pain level is a 15, she will see me on her day off. Not every doctor wants or has the luxury to do that, but there are relationships like that do exist, and that is something that you have to explore for yourself with your providers. One of my nurses, I also text on a regular basis too. She does a lot of wound care for me, and so she's very open. If it's like a Saturday night and my husband, is struggling with helping me change a bandage, he'll take a photo, send it to her, she'll call us, and she'll do that. So it is to say that this almost concierge level of care does exist, but you will have to seek it out and find it and cultivate it, right? There is a very personal relationship with my derm. She's seen me since I was 11. She watched me get married. She watched me go through undergrad. She watched me go through grad school again. She's met my husband. She's seen me through all these phases of life. So there is a very personal rapport there, which is also part of her drive to deliver care. But it's here to say care like this does exist. You do have to cultivate it. It's not going to be the first person you meet. Ooh, I'm a little stuffy today. It's not going to be the first person you meet with, and it may not be the third person you meet with, but you can cultivate a personalized level of care. It's just unfortunate that sometimes we have to do the majority of the legwork to get there.
Yes, absolutely.
Preferences, traits, what matters to you? Age, gender?
For me, it has been gender. All my doctors are. So for me, it's been gender. All my doctors are women, and most of my doctors are women of color. I have gone to many doctors, and sometimes I feel like the lack of empathy when it comes to pain management can be very difficult. Like I've gotten oh, you're strong, you can take it, and things like that. And so I was really intentional about choosing to have an all-woman dream team, and we're like the sheroes,
Yeah.
I mean, flares during periods are excruciatingly uncomfortable, and a female doctor can sympathize with you from the period standpoint, but then add on a flare standpoint, and it's a whole different story.
Yeah, absolutely.
For me, I would say the relationship I have with the provider, their personality, they're willing to hear me out, and that's definitely what I saw in my HS specialist. And although he's a male, but I'm okay with it because he made me feel comfortable in the room, and I could see his empathy just through and through. So that's why I love him.
Yes, exactly. No,
We
empathy is huge.
We hope that people are in the medical profession because they want to heal and they care.
Yeah, so makes a huge difference.
I mean, I would prefer women. With me, I'm kind of a go with the flow. They say, oh, you can see this doctor, and I just, okay. And it happens to be a man, and in my mind, I'm like, I would not prefer that, but again, I just thinking I take what I can get. but I guess I need to learn how to say no. Which is very hard for me to do.
You can have multiple,
right?
like, filter and priority. If you need
Yeah,
more than one
exactly.
derm, you need more than one derm.
Yeah, absolutely.
Yeah.
Yeah, exactly.
Anybody else? Okay.
All right. Awesome. So something we've talked a lot about today, the value and importance of great communication between this patient-provider relationship. It's all going to come back to effective communication.
You got to cultivate the communication too.
Right.
You catch more flies with honey than with vinegar. There are things that I also read the room with my derm. Sometimes she's just having a real menopausal day and does not want to talk, and that's fine too. But there are some days where she's just a real chatty Cathy. But there are things that I remember about her life, like her birthday, for example. It's probably because I've been in the office so long. But there are little personal things that, and again, it is a fine line to toe because there is a doctor-patient relationship there. But there is nothing wrong with saying, how are you doing today? Or like, I really like your hair, this, that. There are little teeny tiny things that increase the emotional rapport that you have with them that helps. And I get it. It's exhausting when you're there. You want relief. But if we can also get in a habit of like, we just got to ask a little bit. We got to cultivate a little bit. And maybe you're already doing this and you have not had a good experience. And for that, I apologize. I'm so sorry. It's not fair. But the little by little, you get a lot.
Yeah, and
how to prepare for these conversations.
Exactly. I think that, it is very often that we go to the doctor, there's a lot that's happened between these visits, and, when you're there in the moment.
She's not disrupting if you want to come up here, or you can stay back there. It's up to you.
Come on in. Yes.
We are very open.
Yes,
Sorry.
Absolutely. Please come on in, have a seat,
Come
get
on.
comfortable.
Grab a packet. I'm sorry if there are spelling errors in the packet. I threw these together yesterday.
Yeah,
Absolutely.
no, Yasmeen is the hero. Yes, so we've all been there. It's the visit. It's hard to remember every single thing. And sometimes it is also a little bit daunting. What is the doctor going to ask? So I put together this list of very common questions and conversations that you might have with your HS specialist that can help guide you. If you want to prepare this in advance, you don't by no means have to, but just kind of to have a sense of, what a visit and what some of the common conversations might look like, so that you feel empowered during your visit, and so that afterwards you're not like, oh, there was like 5 things I forgot to mention.
You will find all of these questions under key takeaway number 2. I'm sorry that these aren't like perfect on like one page for key takeaway number 1 and then one page for key takeaway number 2. It bothers me. But they're there. But almost if you feel like you need to script this out,
yeah,
that's okay.
Yeah.
Like if that's what you have to do to prepare for these conversations, that's okay.
Yeah, or I've also heard some people say that they even at the beginning like almost practice,
yes.
Especially with certain conversations that might be introducing new doctors. Like for example, if you have a new surgeon that you're meeting for the first time, almost like how to plan for that conversation, what information you think is top of mind, etc. So there's a lot of different variations on this, but it can just help ease a little bit of that stress or anxiety going into the visit and make it a more effective and productive conversation.
Mm-hmm. And then the last piece for connecting the dots, you should have pro tip, have a running list in your phone, whether it's an email draft or it's in your notes or whatever, of who your doctors are, who you've seen in the last 3 months, 6 months, whatever, and also put all your medications there. That way you're not scrambling to be like, I don't know, doxycycline, tetracycline, whatever, and
right.
You don't know what your dosages are. You can pull it up and you can say, here's what it is.
Yeah.
And that's just an easy. A lot of times when I talk to my team professionally, I say, what's high lift and what's low lift? What's low lift that you can be a tactical ninja and you can just point me in the direction of, but it's not high lift for you. So that is something that is super low lift. You keep it there, draft in your email on your notepad, and you just make a habit, update it once a quarter, every 6 months, once a year, whatever you need. but it becomes a really
no,
easy
absolutely.
reference point. I didn't realize there was a difference
Instead
between.
of having to memorize it every time.
Yeah, but like also
And
for
being
dosage.
like, what is it again?
And also for
yeah.
like dosages.
Yeah,
Metformin
absolutely.
comes in multiple dosages if you are receiving treatment for PCOS as a comorbidity. I never, like half the time I don't remember what it is, but I look at my notes and I'm like, hey, there it is.
Yeah. And so, like you were mentioning,
I didn't do
there
that
are
on
plenty
purpose.
of digital tools. There are journals and trackers and a bunch of different systems that people can use that can be personalized to their preferences. So, some people want tools to monitor their symptoms, to track progress over time. But in practice, on the next slide.
Oh, sorry.
Oh, none of this is mandatory by any means. I think even when 49% of people talk about maybe wanting these in practice, sometimes it's just not as conducive and feasible with life. And so only 2% of patients actively using these digital trackers. Again, none of these are hard and fast rules. You have to test out what works best for you. But if you try out the journaling and you're like, I don't really know if this is doing much, a lot of it is trial and error. Yes?
So is there a place that you can add for something that you can document?
Yes, absolutely. There's a few different ones. We can add to this. I'm not sure if we did. The HS Foundation also does have different tools and resources to basically track this information over time. So I would definitely look at the HS Foundation. I think they have some great patient resources. Yeah.
For myself, I
Yeah.
live in Baltimore, and I know I hear you saying cultivating a team, but what if finding a team is the
Right.
challenge?
Yeah.
Absolutely.
Because I've been dealing with this in silence basically for over 20 years.
Yeah.
And just finding a team that, they'll tell you you have a HS, but they don't have a treatment plan.
Right.
They don't have a clue on how to manage. The first thing they say is surgery.
Yeah.
They do have a center with MedStar in Baltimore. They say they are specializing in HS, but the first thing they do is talk about is surgery. So I'm looking for a team, cultivating a team let's do a process of elimination.
Yeah.
Right,
Let's unpack this
absolutely.
and try to see if we can do this to decrease your flares before we say we're going to do a
Exactly.
skin draft, something that's to my brain. You do a skin draft.
Major
Yeah.
decision.
Yeah.
Major decision.
So for me, I want to learn. What I want to reclaim here is my voice, that
Absolutely.
I can learn how to advocate for myself. And where they will listen, because I understand. I love the relationship that you have with your doctors. I've only dreamed of having a team that I can call on a Saturday.
Right.
That I can.
That is why we're having this conversation.
Yeah. So I mean,
And
what advice
again-
would you give for me finding a team? Because
Right.
I don't have a place where I can find doctors in Maryland that truly specialize in HS. Because the ones that they have, the only thing they're talking about is surgery. It has to be another team in Baltimore other than the team that's there.
HS Foundation.
Absolutely, exactly. And I think that goes back to this whole idea of trial and error and referencing sources with reputable information or knowledgeable doctors as a point of reference, so that maybe for some people they go to the doctor and they only want to talk about surgery. And I definitely know patients that feel that way, but again, it's never going to be the same for any two people. And so finding what works for you and testing a couple of people, getting a second opinion and feeling empowered to do that is going to be what makes that big difference.
Yeah.
Second opinion has been a challenge because I've had 3 surgeries, and I honestly don't ever want another surgery. That's
Right.
just me,
That's
myself,
fair.
Yeah.
personally. So I just need to somebody to direct me, because even if I have to
Yeah.
go to another state, because I make sure that I have an insurance that I can go to any network.
That's
So
incredible.
if I can find a team that's close to Maryland that I can travel to, I'm willing to do that. But I
Yes.
just need to find that team for myself, so I can cultivate my dream team.
Exactly. And Yasmeen has put together an incredible set of resources that can help to guide, whether it's through the HS Foundation or different resources, different doctors that do specialize in HS that are going to have different styles, right, and different approaches. And so I think that that's incredibly empowering to recognize about yourself and be like, hey, this is what I need from my doctor, and the current person is not meeting that criteria, and I'm going to look elsewhere.
Yeah.
Absolutely.
Yeah.
That doctor, I never went back.
That's okay. You can ghost a
Never went
physician.
back.
Yeah.
So now I'm in search of another.
Yes.
Jasmine found me a dermatologist, so I'm new with her. I've been with her since January.
Great.
I just started Humira, so right now I'm still like,
You're
I don't know if
still
Humira is
figuring
really
it
for
out.
me. I'm just
Right.
trying to learn to document my journey and my side
Yeah.
effects, so I'll know if I need to go to something else.
Here's what I would also say. You will have to sit with your treatment plans. I know that part sucks because they don't always work, but we have to know what doesn't work before we can move on to something else.
So that's what I'm doing. So
Yeah.
I'm doing that with Matt. She has me on treatment plan. So right now, she said she's doing 3 to 6 months.
Yep.
To see and document it.
Listen, it took me 2 years on Cosentyx to get where we are today. And it was a rough 2 years. Like, real rough. Like, my therapist was like, lean into the curiosity of getting over the hump. And I'm like, how many times are you going to say this? I am tired of it.
Right.
So here's what I will do. Again, I want to be conscious of time because we do you guys have probably seen like a little spreadsheet at the end. I'm going to walk you through a tracking tool that we've built for budgeting. So I'm going to move us a little bit faster, but here's what I am going to ask. Yes, we can
Yes.
absolutely send one of those back to you. You
Yeah,
can also come up and grab
it's-
one.
I think we referenced it in
before-
here, and it's on the HS Foundation website, but yes, that is a good one.
Before you guys head to your next sessions, I'm just going to ask you to write your emails down, and we will send out a synopsis with more targeted direct hyperlinks and stuff like that. I know some of you guys came in halfway through, et cetera, et cetera. So like, if you can leave me with your emails, we promise not to spam you. I'll put together like a concentrated summary, and we can, just so you guys can make sure that you have access to the resources that have been vetted by physicians to help you get where you need to go. Yeah?
Yes.
Okay, cool. Pro tip. The back office coordinator, the medical assistants, the nurses, the front office people, they are your best friends. They will help you with documentation. They will help you get what you need. You have to build a rapport with them. I get it. I've said this a lot. It sucks when you walk into that office and you're in pain and you're just like, fuck the world. I don't want to be here. You got to smile. You got to say hi. You got to say, how's your daughter? How's your pet? Whatever. I like your glasses. You got to give a little bit, because these are the people that will help you with your prior authorizations, with your step therapy documentation. These are the people that will also help you if you need to see the physician sooner. Let's say they say their nearest out is 3 months, and you're like, I don't have 3 months. If you got a nurse and you know that nurse and you have a friendly rapport with that nurse, chances are that nurse can probably help you find some time a little bit sooner if you don't have that rapport with the physician. I will give you an example. Her name is Michelle. I love Michelle. Michelle has seen me since I was 10 years old, when my mom used to take me to appointments, and then when I started driving myself when I was 16, and then now with my husband. Michelle is my best friend in the back office for making sure that I get my Cosentyx paperwork and prior authorizations and universal claims forms done. She knows I will send them to her on January 1st because that is the start of my insurance year, and I will tell her, I need this claims form for this medication. I need this PA for this. We don't have to deal with step therapy documentation. Here's everything. Hey, I changed my name this year, which, by the way, if you do change your name because you get married or for whatever reason, be prepared. It is not fun in the insurance land. I'm sorry about that. But she understood. She's like, is your name Yount or is it Ahmed? I'm like, it's Yount. And she's like, okay, well, so your insurance card says Yount, but your Cosentyx prescription is going to say Ahmed. So here we go. So just, these are the kinds of conversations. These people are there for you. They also do a very thankless job a lot of the time. I give her a Christmas gift. She gets an ornament from me every year. It's real simple. It's real clean. I know when her birthday is. If I'm in the office within like 2 or 3 weeks, I'll bring her some flowers or something like that. Just something small and simple.
Yeah.
They do a very thankless job.
I do think that they are kind of the team that empowers your doctor
Yes.
to be able to deliver, phenomenal care, right? Like we put so much effort into picking the right clinical operations team members because it makes such a big difference in the patient experience, and in ensuring that the doctor is aware of all of the critical aspects, and kind of being that bridge and that communication between the patient and the doctor for every time that you aren't directly communicating with them. So, so they definitely make a huge difference. They are processing most of the PAs and everything, and really keeping things moving, and a great resource for you to check in with and be like, hey, where are we on this? Still waiting, just wanted to send a little reminder.
Same with MAs, same with nurses. I don't know if any of your practices that you guys are in have nurses or MAs or both. It's okay to have a rapport with all of them. Again, we hope that they're in the medical profession because they want to heal and they care.
Yes, absolutely.
So,
Yeah.
all right, key takeaway number 3, have a plan and operating system to make your journey sustainable. How many of us struggle with organization? How many of us struggle with budgeting? How many of us struggle with tracking? How many of us feel like it does not sound like a fun party on a Saturday morning to fill out a spreadsheet?
Yeah.
We're going to change that. And Chester, I'm going to have to send you another document that I need you to project for me in a little bit. Thank you. All right. Support systems. How many of us have support systems? It's okay if your support system is just your therapist right now. That's okay. Yes. Did you have a question?
Oh, no, I was raising my hand for the support.
Okay. How many people have support systems that are family? Do you feel comfortable with your family as your support system? How many people have friends that are their support system? And how comfortable do we feel with your friends as your support system? Your family does not have to be your support system. My mom, God love her for all of the wonderful things that she does, and this kick-ass, take no prisoners attitude that I have in the professional world is from her. She is terrible at my HS care. Terrible. Like, to the point that when I was 16, my mom was in an appointment with me and could not control herself, could not control her emotions, and rightfully so, your child is in pain. Right?
Yeah.
Rightfully so, your child is in pain. And my doctor ever so eloquently was like, Yasmeen is 16, she can drive. On surgery days, we keep the practice open longer. I'm more than happy to wait to see her at 4:30 in the afternoon on Wednesday, and then she can drive home, but we'll call you if for whatever reason she can't drive home. That was a very subtle hint of my doctor and me kicking my mom out of my care.
Get out. Yeah.
Now, this meant that I learned from a very young age that, I had to walk home with all the receipts and all the documentation and all that stuff. But it is okay if your family is part of your support system, but is not directly your support system. Friends are also awesome. Spouses are awesome. I think our caregivers that are spouses or best friends, we require a lot. And a lot of times I feel like we probably feel like we can't give a lot because we require so much. And as my husband likes to say, it's never 50-50. Sometimes it's 70-30, sometimes it's 90-10 in both directions. Yeah. And that's okay. But you have to have a support system. Support groups, therapist, friends, the AHSID community. It's here for you. I understand we only meet once a year, but we have so many resources to connect you with support groups. Mm-hmm. So we will make sure that we get you some direct hyperlinks to where to go to find that stuff. I'll take that as a takeaway. But does anybody feel like they're missing something in their support group that we can maybe help solution around?
Like their support team or
their
network.
Support team.
Yeah,
Yes.
Exactly.
We're big on the team word today.
Yeah.
Yes.
I'm missing involvement. I feel like I can have discussions with my friends and everything's fine, but but having those around me actually be involved and do their own due diligence to be better support for me, I feel like that's a topic that's really hard to approach.
So how many of us feel really uncomfortable when people give us feedback, personally or professionally? How many of us
giving feedback?
Or giving feedback.
Yeah.
How many of us don't like having those conversations because they're uncomfortable?
Super uncomfortable.
So, a professional mentor said to me, you have to learn to be uncomfortable with the discomfort because all feedback is a gift if it's given and received with the best of intentions, right? So I would ask yourself, what do you want out of that involvement? Is that somebody coming to an appointment with you? Is that somebody just coming and sitting on the couch and watching TV with you? Is that somebody helping you cook 1 or 2 meals because you're just really, really tired? And then you've got to approach that subject and fully understand that that conversation will solicit one of 2 consequences, a positive consequence or a negative consequence. A positive consequence meaning that person is willing to move forward and to help you. Negative consequences, maybe that person is no longer a nuclear friend, but rather an acquaintance friend. And that conversation is really uncomfortable. And it's okay. But if you need help and you have to tell them how you need help, they're never going to know until you have that first conversation. But it also takes a lot of courage and strength to initiate that first conversation. But it's okay, right? The people that are meant to be in our lives are going to be in our lives. We just got to do a little legwork.
And assertive communication.
Assertive
right?
communication.
It's not aggressive communication. It's assertive in that we can't expect people to, read our minds, and sometimes people are completely unaware, and different people have different levels of EQ, of being able to read people's emotions. We want people to, be in tune with what we're feeling, but sometimes we just need to be a little bit more explicit. It's definitely something that, I've received as feedback of just being more direct and, being very straightforward, because sometimes people just, just don't have that awareness, and if they're not aware, they're not going to be able to be that support system, even if they want to.
And assertive communication is uncomfortable communication. My father likes to say, hype yourself up in the mirror. Practice that conversation, do what you got to do. But I would like to think that we would like to live over the hump as opposed to continuously having to climb the incline, right? So I get it is uncomfortable.
Yeah.
I affirm that. But again, being assertive is really helpful. Did you have a question?
Yes.
Because I want to learn how to have the uncomfortable
Yes,
conversation.
absolutely.
So maybe that is a session that we do. I will make a recommendation for Jasmine, or I'm still a certified behavioral scientist.
That is a big conversation, yeah.
So I'm still technically certified in that, so we
Yeah.
could have a conversation about antecedent behavior consequence, whereas the antecedent is you put forth the variable, you see what the solicited behavior is, and the consequence is either positive or negative. So we can have a conversation I'll have a conversation with Jasmine about whether or not we can create a structure. For that, when we say ABC conversations, it's literally like reading from a script, because in your mind you're preparing, I'm delivering the antecedent, I'm waiting on the person's behavior, is the consequence positive or negative, and then you sort of know, it's binary. All right, it's positive, yay, move forward, breath of relief. It's negative, okay, I know, this is what I'm prepared to do moving forward.
Interesting.
And that's what I'm saying.
I've never heard of that.
In my mind, because two of my best friends called me like, what type of event are you going to again? You didn't give us the breakdown. So I'm still, and I'm like, well, I'll let y'all know about it. I still dismiss the conversation.
Yep.
Because they called me on a conference call, and I'm like, I dismissed it, and I know these are my support system.
Right.
So why am I
And it
uncomfortable?
sounds like
Because I
they
think
wanna
I'm
know.
practicing.
They want to know. They want to know where they
Right?
can
They're
go.
Practicing
asking
in my
us, they wanna
mind of
know.
what's
Yeah.
going to be, like you said, the negative or positive backlash from it.
Yeah.
Yeah.
So
I'll talk to Jasmine and see if one, we can put that on the schedule for next year, but 2, get you guys some interim resources.
Yeah, because it's definitely a challenging conversation for everyone, and your friends reaching out, it sounds like they want to know more about your life. They're interested.
Yes.
They are engaged, and so how to have these conversations is definitely really challenging. Right.
It ain't no secret. I'm sorry. They can come. We love volunteers. All right. So last thing is what I call, everyone's heard everything but the kitchen sink, right? This is insurance, finances, patient proactivity for additional areas of health, PT, nutrition. We're going to hyperfixate on that last one. Additional areas of patient health. Y'all, do not neglect getting your teeth checked. Do not let your mental get in
I
front
need
of
to do
your
that
dental. Teeth are expensive, okay?
Keep putting it off, but I got to do that.
How many of us stare at screens that are not full brightness all day long? I had perfect vision up until 3 years ago when I started having to edit code. So now I have the funkiest prescription on my glasses. You cannot omit the things that can incrementally add up and affect your total health. If you have the resources and the access to do it, knock it out. I do all of my annual appointments in the first quarter of the year. January 1st, I send emails to those offices. I'm on those schedules. Full stop. Same for cleanings, like teeth cleanings. I don't like it. I don't like people in my mouth. I don't like it, but I do it. I wanted to get better at flossing, so I did some habit stacking. And I floss while I'm waiting for my moisturizer to set before I move on to my hair. So like these little incremental things you've got to take care of. How many of us feel, this is a very touchy subject. Remember, I'm also a patient. How many of us feel like HS keeps us from having the type of body or physical strength, presence, whatever that we want to have? How many of us have proactively tried to have this conversation with a physician? How many of us were just told, okay, you just need to lose weight? Okay, so I'm going to paraphrase for Dr. Ghias because I know that this is Ghias. I'm sorry.
Oh, no. No worries.
It is very difficult for a physician to make comments on women's bodies or anybody's bodies and weight because obesity is a real thing in America, and it is a very touchy subject and it's a very sensitive subject. It is loaded with lots of variables that sometimes we can control and can't control. So it's almost like you talk about it, but you don't talk about it. It is okay to reach out to a personal trainer. It is okay to reach out to a physical therapist. It is okay to seek out somebody that can just help you regain basic movement. How many people who have HS let's not say actively flaring or not actively flaring in their underarms in this room? How many of you have full range of motion in your underarms? It's okay. If you don't have full range of motion, the whole point is how many of you would like to strengthen that full range of motion? It's a pretty common occurrence that mobility is something that we don't talk about in HS, and proactively you should consider seeking out some resources. I understand that physical therapy is a more privileged resource because it is difficult to find a physical therapist that specializes in it, but just much like anything in your care team, that first person, that second person, that third person, they may not fit, but that fourth or fifth person, they may fit. Life is not kind to women. After 40, we start to lose muscle mass. Muscle mass is one of the things that helps support our body as we age, our joints as we age. And if we got to take this disease into aging with us, we also got to think about taking care of ourselves. And that means nutrition, diet, and the mobility piece of it. We will work on getting you some resources for the PT part of it. If you don't have access to those resources, I have that as a takeaway for Jasmine and I. So we will work on that. But I wanted to say, like, how many of you feel that way about your bodies and your strength? Because you are not alone in this room. And I know it's kind of hard because you're sitting here and you're looking at me and I'm like real skinny and trim and all this stuff. It is work. And it is work where for the last 4 months, I was not allowed to do anything because I was healing from surgery. And so my body has been going into its reserve muscle mass to support that in an optimal recovery environment. And so I was just cleared. I will be back in the gym, hitting it hard in 2 weeks. And I have goals set for the next 8 weeks. But it is to say, like, I have been where you are sitting. It is hard, but it is solutionable. Yes?
I just want to add, in addition to physical therapy, I'm a massage therapist. Massage therapy has been wonderful for myself as well as my clients.
It is okay to take care of yourself. It is okay to let somebody, I get lymphatic massage as well as deep tissue because, I get stressed out a lot. I also get my nails done regularly. It's like a little thing for me that just, it works for me. It makes me happy.
Yeah.
But yes, you can't omit self-care from it too. And I understand, we're like, self-care, PT, nutrition, dermatologist, obstetrician, gynecologist. Y'all, this is our life. It sucks. But the sooner we get comfortable with it and the sooner we start orchestrating it and creating some sustainable systems around it, my system may not work for you, but my hope is that if you take a modicum of my system and apply it and it improves your life by 10%, 15%, that's more than you had yesterday, right? So little by little is a lot. You probably heard Dr. Oha say it yesterday. It's because I learned it from her. She says hair by hair, increment by increment. It doesn't matter. A little bit is more than we had yesterday.
Yeah. And the journey, all of these things don't need to happen tomorrow. I think it makes it a lot less daunting to kind of like you said, incrementally start layering in these elements over time. It just makes it much more manageable. And again, yeah, it's really a process and a journey.
So hard truth. Who in here feels like a professional patient sometimes? Who in here also feels like you're a professional patient on a shoestring budget and then you're just told to wear loafers? Right, my husband's actually wearing loafers today, so it wasn't intentional. He does have tennis shoes in our hotel room. So we're gonna talk a little bit about appointments and tracking and all of that. So I wanted to put this up here for you. 2.576 was the average number of appointments I had weekly in 2023 that required me to receive and pay for care. I omit in-office purchases or pharmacy runs, and I want to ask yourself, how many appointments do you think you had on average in the last 3 months? Incalculable,
Maybe
right?
the last year.
Or in the last year. So I just picked some arbitrary numbers. Now multiply that by, let's say, 40. How much did it come out to? Multiply that total by 4. There's your yearly average cost per appointment. If you're not tracking this, you should be. And we're going to talk about why. How many people get really uncomfortable when we talk about budgeting and numbers and accessing care? And I don't mean uncomfortable as in like, I'm not good at math, but I mean uncomfortable as in like, oh shit. Yeah, cool. So hold off on scanning this because I will send it out in updated email. Chester, did you get the new file that I sent you? So if everybody wants to go to that page that has an Excel sheet in it. And Chester, if I tell you to like plug in some numbers in a cell, can you do that? Or would you like my husband to do it for you?
Either way.
Honey? Okay, don't do it. He's also very introverted. This is like a kind of situation that makes him a little bit anxious. And then he married like a really big extrovert, so here we are.
It's a good balance.
They do say opposites attract.
Yeah.
I also want to say happy marriages with HS happen. Happy relationships with HS happen. Y'all are welcome to ask him anything you want. We're pretty open books about that kind of stuff, but they do happen. So, as we're pulling it up, how many people feel like they're bad at math? That's okay. How many people feel like they're halfway decent at math? That's also okay. How many people have no idea how to track their expenses for medical purposes because you get confused with what's a copay, what's out of pocket, what's this, what's that? Here's what we're going to do. We're going to organize all of it. I want to preface, this is a tool. If you choose to adopt it and operationalize it through Curated and Collected, I'm more than happy to help teach you how to do it. But again, from a terms and conditions perspective, we are offering our professional expertise as best practices. You are neither clients nor patients of ours, so just a general statement there. And we got 5 minutes to go through this. We're going to run over. I need 8. Full stop. Cool. Okay. So in our first, I assume that that's the little, hey, that's weird. So, all right. What you have, I'm just going to stand behind you. No, you're good. You're okay. So DOS in this first column. So this is what I will give you is actually interactive. So like if you go in and you plop the dates in, it will populate for you. The reason I just gave it to you static on a sheet is so that you have a reference point and we'll go through one together. So DOS is date of service. And you can put in 01/04/2023, 2024, whatever your date is. Your next category is your provider. Is it a dermatologist? Is it a dentist? Is it OB/GYN? These two are for the purpose of illustration. Description, copay skin lesions, biannual cleaning, copay skin lesions, annual visit, quarterly visit, follow-up. Category, is it dermatology, dentistry, dermatology, OB/GYN, functional medicine, PT, whatever. Put those categories in there. The next, what is your cost? This is a copay. This is arbitrary. I don't know what my copay for my dentist is this year because I haven't gone yet. I'm going in 2 weeks. Dermatology copay. My annual OB/GYN visit is covered fully. And then we're going to talk a little bit about what this $3,050 is and this $450 is. Travel. How many of you know that you can claim your mileage on your medical expenses?
This was news to me.
Cool.
I had no idea.
I built some formulas in here, but it is roughly, you can be reimbursed 21 cents a mile for travel to and from medical care. A lot of people don't seem to know this. All right, so when we say SA reimbursement, how many of us have HSAs versus FSAs? How many of us have an HSA or an FSA? How many of us are paying out of pocket? Okay, so for folks paying out of pocket, this is really important for you to track. Globey went over this yesterday. I can walk you through this separately. So what you're going to put here is what your reimbursement is. Theoretically, a copay from a dermatologist you should have no problem getting reimbursed for, right? That is what your HSA and FSA funds are for. They're for copays, they're for cleanings, they're for things like that. So when you see reimbursement, this means I got this money back through the pre-tax dollars that I set aside with my employer. Remaining to Schedule A. So Chester, at the bottom of the sheet, you'll see a Schedule A. Don't select it yet. Remaining to Schedule A. So when you go to file your taxes, how many of us use like Rocket Mortgage, TurboTax, Edmund Jones, any of those for taxes, versus how many of us use a CPA or our parents to help us file taxes? Okay, so your CPA should be super familiar with what a Schedule A is. A Schedule A is essentially an additional tax document for any expenses that you think could potentially be reimbursable for your taxes at the end of the year. And then lastly, we're going to talk about remaining to Schedule A is a formula that I have. I'll explain it in a second. Reimbursement. So this is reimbursement notes. So required and updated prior authorization, no cost annual appointment, fee for service, meaning I paid out of pocket. Submission. Did I submit it? Was I reimbursed? Completed. Is it in progress? No reason for denial. Was it denied? Appealing through back office. Is it completed? The annual was covered by law, right? Here's a really clean way to put it in there and just keep it per appointment. And this document is live, so you technically could edit it live or just set aside time every month, like every first Monday of the month for the first 2 hours. Gonna do some bookkeeping. And then lastly, for mileage reimbursement, for any of your providers, all of those mileage calculations are just the same right now, meaning they have the same number in there, but if you put in the mileage, it will multiply it out for you by 22 cents. And that's what that explanation is up there. Chester, can I have Schedule A, please? Thank you. All right. So, medical expenses deduction calculator for your Schedule A. Remember, this is a tool to take the organized, itemized documentation to a CPA or your tax professional to understand what, if any, is reimbursable. First thing first is medical expenses deduction based on gross income threshold. So let's say your annual gross income for 2023 was $50,000. The threshold that you have to exceed for paying for medical expenses is 7.5%. So 7.5% of $50,000 is $3,750. It means you have to exceed $3,750 to claim it on your taxes. Now, here's what it doesn't mean. If you exceed, say, $3,751, you're not going to get that whole $3,751 back. You're going to get that $1 back. That is where you start. That is your zero. I'm sorry, it sucks, but at least it's there for us, right? So all of this is pre-formulated. But what it'll come down to is, you can put in your, I have an FSA, this is my FSA maximum for last year. So when you saw on the other sheet, $3,050, I just put it in there for visualization purposes. I spent all $3,000, I couldn't tell you how much we spent. Multiply this by 4. That's how much we spent on care for me in 2023. So anyways, there's nothing remaining in a health savings account, which means I'm now out of pocket, so I need to track it. Or maybe you're in your insurance land and you've met your out-of-pocket maximum for insurance. You still want to track all of that. You still want to know what's being spent where, so you have a good visualization of how that works. What comes down here, what's in the red, is the 2023 non-reimbursed cost of care. So that $618 is $3,050 plus $618. So what we end up here is my total cost of care. It's $3,668. That $618 was not reimbursed versus that $3,050 was reimbursed because it was in an HSA or an FSA account, right? So what happens is We then say, what's the distance from the threshold? So if I have to spend $3,750 additionally on my healthcare to start claiming it on taxes, that 618 has got to hit 3,750, and then this will change to positive, and that is what you can take. And the whole point of this is you can then take this to a tax professional to help you look for things that are qualifiable medical expenses like wound care, like physical therapy, like nutrition. Maybe, so we have to hoard where we spend my FSA money. Like my FSA money is either PT for an entire year, my derm for an entire year, or my therapist for an entire year. That means 1/3 of my care team is covered by my FSA. So the rest we're out of pocket for. So you best believe that we are prepared with this when we go to talk to our CPA at the end of the year for what is reimbursable. Yes? Mm-hmm. It's okay.
All right, perfect. And so I guess my question would be, in terms of wound care, when you're keeping up with things like this, do we have to keep our receipts
Yes.
as well?
Keep your receipts, take photos of them. I highly suggest, how many of us have Google Drive accounts, Gmail accounts? So Google Drive is free with a Gmail account, right? Make a folder in there, take photos of all your medical expenses, take photos of your receipts, your copays, whatever. Put it all in there, organize it however you want to. I do it annually, and then James and I go through and do it quarterly. And that's how we do it. So just, it sucks that we have to track this way, and I'm sure there's a business plan in here that I could have a conversation with your husband about how we create an expenses tracker as part of Tono Health. But there isn't a good tool yet that lets you track it like a travel and expenses tool that you would have for a company or something like that.
Okay, thank you.
But yeah, so Jasmine just came in and said our grace time of 5 minutes is 5 minutes. Are there any, so as takeaways, we will get you an updated summary with the direct links to the resources that we talked about. I will send it out to all of your emails, so I've got all of that. If you want more training on this tool, I will also talk to Jasmine about setting up a follow-up session, and then we can find some time to do this. Are there any other questions about building your dream team, tough conversations that we can help field for you? Yes. Oops, sorry.
Where does your naturopath fees come in on here? Are they reimbursable or not?
So they are reimbursable under Schedule A. They're not
They are.
reimbursed. Yeah. So
Not through the FSA or HSA.
Here's the thing. So every FSA and HSA is going to have its own flavor to bureaucracy. Yeah. I find
I've just completely not done that because it's too difficult.
Correct.
So this is cool.
So it's easier for me to just say, all right, we're going to use my FSA for therapy for this year.
Exactly.
And I will keep track of all of my functional medicine. But it does mean I will have to wait until tax season to get reimbursed. So it does require some budget finesse, if you will.
And does that include supplements or no?
That's a conversation you need to have
with the CPA.
Mm-hmm.
Cool.
Amazing.
We're almost there.
Yes.
And guys, we'll be hanging. Yes.
I just wanted to add my email to your list.
Sure.
Yes, absolutely, and definitely.
Does anybody
feel
have a pen
free
she can
to
borrow?
Contact us.
Yes.
Anytime with any other questions. And yes.
What's up, Flo?
I first wanted to say just thank you guys so much for just like creating this space to educate all of us on what it means to have an amazing dream team. I did just want to make the suggestion to the tracking that you were talking about. I mean, I use notes for my tracking. That just works for me. But I do know of an app. It's called the Papaya app. It is made for HS patients. So you can track every single detail about your HS. And if that's your style and that's what you want to use, it definitely has worked for a lot of people.
Yep.
So.
Yes.
Just a quick question for those of us that may travel a lot. That's kind of the area that I want to work on a little bit better so that if I am traveling and have a flare or just generally
I'm on the road
speaking.
48 weeks out of the year.
What'd you say?
I'm on the road 48 weeks out of the year.
Gotcha. So I'm in a similar scenario.
Yeah.
Let's chat about this afterwards. Okay.
Yes. Likewise. Yeah. Absolutely.
Anybody else? Anybody got any feedback? You feel like we didn't touch on anything that you wish we would have touched on more of?
I just have a quick question on the spreadsheet since it's right there on cell C14 lock spreadsheet on 12/31. What does that mean?
I lock the spreadsheet so that it is no longer editable, so I can export it to a tax professional ahead of tax season.
So that's just a note for yourself to lock it. Okay, thanks.
Just send all the great information in emails. Thank you, ladies.
Of course. It was so wonderful to have you.
And remember,
Thank you. Thank you so much.
yes, of course,
Oh, yeah. of
Tono
course.
Health, HS Foundation, curated by doctors for patients.
Yes.
By doctors. Not by Instagram, not by TikTok. Not by your next door neighbor who thinks that they relate but can't relate. By doctors for patients.
Yes.
Okay?
Did anyone not get one
Did
of
anybody
these
not get a
packets
toolkit?
that would like one?
A couple extra.
Sure.
Of course, absolutely.
Yeah.
I just wanted to say real quick, Dr. Ghias is my doctor. I started with Tono Health. I found out about Tono Health through this summit last year virtually. I found them on the HS Foundation's website, and I was just very curious on how they didn't have a location and everyone had a state. I live in Florida, and Tono Health is not in Florida. Well, they're everywhere.
Yeah.
And
22
so-
states. We're in
Yes,
22
and so
states, yeah.
they've definitely been a blessing to my life. So if you are open to virtual appointments, don't shy away from it, even if it's something that piques your interest. All the things that normally you would do at a physical doctor is available to you virtual. Like if I need a prescription, oh my God, the prescriptions are the fastest. By the time I'm off the call with Dr. She's like, I got this for you. And I'm getting the notification from CVS on the call with her that the prescription has been received and it's going to be done. And all my labs and all my x-rays and all the blood work and everything. So
Brings up a really good point. How many of you guys pay attention to your HIPAA releases when you're filling out your new patient paperwork? Cool. If you want providers to be able to talk to each other, you have to include
Yes.
them on the HIPAA release.
Yeah.
Also, do not leave anybody on the HIPAA release that you do not want to have access to your information. My mom is not on the HIPAA release. God love that woman. She's got to call my best friend or my husband. She ain't. So just remember, if you want them to be able to communicate, let's say in a time of extreme pain or in surgery or in post-recovery, that HIPAA release is critical because.
Yeah, because otherwise
Just
our
because.
hands are tied. We
Full
can't do
stop.
much.
Full stop.
Yes,
She can't
yes.
do anything short of like going through probate court, and we're not. That's like, let's not do that.
Yeah, yeah.
HIPAA releases are very
Makes
important.
everyone's life easier.
Even when it comes
Yes.
to pharmaceuticals, I used to work in specialty farms, so I used to send out biologics like Humira and Enbrel, things like that. And parents would want to advocate for their children, spouses would want to advocate, but if you're not on HIPAA, it's kind of like Fort Knox. So
But you guys can connect with us. You can connect with Dr. Ghias through Tono Health.
Yes,
my Instagram is on there. You guys are welcome to connect with me there.
It was so wonderful,
wonderful.
speaking with you all. Thank you so much for being
Yeah.
here. It was so